Hello everyone, welcome back to our channel. Colorectal cancer is a silent killer, one of the most prevalent and dangerous forms of cancer in the world, yet it often goes unnoticed until it's too late. Shockingly, many people remain unaware of the subtle warning signs that could save their lives. What makes this cancer even more insidious is that, when caught early, the chances of successful treatment and survival improve dramatically. But how do we catch it early? It's all about recognizing those first signs, signs that many of us may overlook or brush aside. With more than 1.9 million new cases of colorectal cancer diagnosed globally each year, it's clear that this is a growing health crisis that demands our attention. In today's video, we'll walk you through 11 key symptoms that could be warning signals of colorectal cancer, symptoms that you should never ignore. Whether it's a change in your bowel movements, persistent discomfort, or something as subtle as unexplained fatigue, these signs could be telling you that something's wrong deep within your body. By learning to identify these critical signs early, you take control of your health, enabling you to seek medical advice and treatment at a stage where it can make a real difference. The truth is, colorectal cancer doesn't always come with dramatic symptoms right away. But don't let that fool you, this disease can grow silently. That's why it's so important to stay informed and proactive. In this video, we'll go in depth into the 11 crucial symptoms that could potentially save your life. Your health is your most valuable asset, and understanding these signs is the first step in safeguarding it. Stick with us as we dive deep into the details, and remember, recognizing these symptoms now could give you the time you need for early intervention, helping you to avoid the more serious consequences later. Don't wait, because your well-being deserves to be a top priority. Colorectal cancer is a type of cancer that begins in the large intestine, also known as the colon, or in the rectum. It typically starts as small, non-cancerous growths called polyps on the lining of the colon or rectum. These polyps may remain benign for a time, but if left undetected, they can develop into cancerous tumors over the years. While colorectal cancer is more common in older adults, particularly those over the age of 50, it's important to know that younger individuals can also be affected. Early detection is key in managing this disease, and one of the most effective ways to catch it early is through regular screening, which helps identify precancerous polyps before they have a chance to turn into cancer. By understanding how colorectal cancer develops, you can take proactive steps in your healthcare journey. Regular screenings and being aware of the symptoms can significantly improve outcomes, preventing the disease from progressing and allowing for timely intervention. This early awareness is vital in protecting your health and ensuring you catch the disease in its earliest stages, when it's most treatable. 11. Hypertrichosis lanuginosa acquisita, HLA. Hypertrichosis lanuginosa acquisita, HLA, is a rare and concerning symptom often associated with advanced internal malignancies, including colon cancer. It manifests as the sudden growth of fine, downy, unpigmented hair all over the body. This contrasts sharply with normal hair growth patterns and existing hair texture. The new hair is typically soft, light in color, and covers large areas of skin, creating a fuzziness. This abnormal hair growth isn't merely an increase in existing hair, rather, it's a distinct change in hair type and distribution. The development of HLA is a significant warning sign, as it often indicates a serious underlying condition requiring immediate medical attention. The connection between HLA and cancer is not fully understood, but its appearance warrants thorough investigation to rule out advanced malignancies. If you experience this unusual and widespread hair growth, seek medical advice without delay. 10. Malignant acanthosis nigricans. Malignant acanthosis nigricans is a rare but serious skin condition strongly linked to certain cancers, including colon cancer. Unlike benign acanthosis nigricans, which is often associated with obesity or insulin resistance, the malignant form develops rapidly and dramatically. It presents as dark, velvety, thickened skin patches, often resembling dirty skin. These patches are typically found in body folds such as the armpits, groin, and neck, but can also appear on other areas. The color can range from dark brown to black, and the texture feels rough and hyperpigmented. The rapid onset and intensely dark pigmentation differentiate it from the benign form. The appearance of malignant acanthosis nigricans requires immediate medical attention for thorough investigation, including cancer screenings, as it serves as a potentially life-saving warning sign. Prompt diagnosis and treatment of the underlying cancer are crucial. 9. Lesser Trailat sign. Lesser Trailat sign is a rare but significant skin manifestation associated with several internal malignancies, including colon cancer. It's characterized by the sudden appearance or rapid worsening of multiple seborrheic keratoses, benign, wart-like growths often accompanied by inflammation and changes in their texture. These skin changes can be quite dramatic, developing quickly over a short period. They're typically described as intensely itchy, scaling, or even bleeding. While seborrheic keratoses themselves are common and harmless, their sudden, widespread, and inflammatory onset warrants immediate medical attention. The presence of the lesser Trailat sign necessitates a thorough medical evaluation to rule out underlying cancers, such as colon cancer, given its association with internal malignancy. If you experience such a sudden and significant change in your skin, a prompt consultation with a dermatologist or your primary care physician is crucial. 8. Pencil-thin stools. One lesser-known but potentially concerning symptom of colon cancer is the presence of pencil-thin or ribbon-like stools. This change in stool shape and size can be an important warning sign that warrants further investigation. Colon cancer can sometimes cause a partial blockage or narrowing of the intestines, leading to the passage of thinner, more elongated stools. As the tumor grows, it can constrict the colon, limiting the space available for stool to pass through comfortably. It's important to note that not all narrow or thin stools are a sign of cancer. However, if you notice a persistent, unexplained change in the width or shape of your stools, it's a good idea to bring it up with your healthcare provider. Paying attention to any significant alterations in your bowel habits, including the appearance of your stool, can help identify potential issues early on. Don't hesitate to discuss any changes, no matter how minor they may seem, as they could provide valuable clues about your colon health. 7. Anemia. Another potential symptom of colon cancer is anemia, a condition characterized by a deficiency in red blood cells or hemoglobin. Anemia can manifest in a variety of ways, but some of the most common signs include persistent fatigue, weakness, and a pale or sallow complexion. Colon cancer can sometimes cause slow, chronic bleeding within the digestive tract, which can deplete the body's iron stores and lead to anemia over time. This blood loss may not always be visible in the stool, making it an insidious symptom that can be easily overlooked. In addition to feeling constantly tired, individuals with anemia related to colon cancer may also experience dizziness, shortness of breath, and a rapid heartbeat, even with minimal exertion. They may notice their nails becoming brittle or their skin feeling unusually dry and cool to the touch. If you're experiencing these types of symptoms, it's important to bring them to your doctor's attention. Anemia can have many potential causes, but it's a sign that your body may be struggling with an underlying condition, including the possibility of colon cancer. Early detection is key, so don't hesitate to speak up. 6. Unexplained weight loss. Unexplained weight loss is another potential red flag when it comes to colon cancer. If you find yourself shedding pounds without making any deliberate changes to your diet or exercise routine, it's a symptom that deserves attention. Colon cancer can sometimes interfere with your body's ability to properly absorb nutrients, leading to unintentional weight loss. This may be accompanied by a poor appetite, nausea, or a general disinterest in food. Some individuals with colon cancer also experience unexplained muscle wasting, where they lose weight and muscle mass despite their best efforts to maintain a healthy lifestyle. It's important to note that weight changes alone do not automatically mean cancer is present. However, if you find yourself dropping a noticeable amount of weight without trying, say 5% or more of your total body weight in a short period of time, it's worth mentioning to your healthcare provider. Sudden unexplained weight loss can be a concerning symptom that warrants further investigation to determine the underlying cause. 5. Weakness or fatigue. One symptom of colon cancer that often gets overlooked is persistent unexplained fatigue or weakness. This goes beyond the normal tiredness we all feel from time to time. It's an overwhelming sense of exhaustion that doesn't seem to improve with rest or lifestyle changes. Individuals with colon cancer may find themselves feeling drained and lethargic on a regular basis, despite getting adequate sleep and maintaining their usual routine. This extreme fatigue can make even the simplest daily tasks feel like a significant effort. You might find yourself lacking the energy to participate in activities you once enjoyed or needing to take frequent breaks throughout the day just to get by. While fatigue can have many potential causes, it's an important symptom to be aware of, especially when it's severe and doesn't seem to have a clear explanation. Unexplained persistent weakness or tiredness could be a sign of underlying issues, such as anemia or the cancer itself causing an imbalance in your body. If you find yourself constantly struggling with fatigue, don't hesitate to bring it up with your doctor for further evaluation. 4. Feeling of incomplete bowel emptying. Another concerning symptom that may indicate colon cancer is the persistent feeling of incomplete bowel emptying. This is a sensation where, even after using the restroom, you still feel like there's more that needs to come out. It can be an unsettling and disruptive experience that impacts your daily life. This incomplete emptying feeling can manifest in a few different ways. Some people describe it as a lingering pressure or a sense that their bowels haven't fully evacuated. Others may feel an urgent and persistent need to have a bowel movement, even shortly after just going. This can lead to frequent trips to the bathroom and a general feeling of discomfort or dissatisfaction. It's important to note that the occasional sense of incomplete emptying is not necessarily a cause for alarm. However, if this becomes a consistent nagging issue that doesn't seem to resolve, it's worth bringing up with your healthcare provider. Persistent feelings of this nature may be a sign of an underlying condition, such as a blockage or tumor in the colon, and warrant further investigation. 3. Persistent abdominal discomfort. Another potential warning sign of colon cancer is persistent abdominal discomfort or pain. This can manifest in a variety of ways, such as chronic cramping, bloating, gas, or a general feeling of unease in your midsection. It's important to differentiate this type of ongoing discomfort from the occasional stomach ache or indigestion that we all experience from time to time. With colon cancer, the abdominal pain or discomfort is often more severe, frequent, and disruptive to your daily life. You may find yourself dealing with it on a near-constant basis with little relief, rather than just experiencing the occasional bout of discomfort. The pain may also be localized to a specific area of your abdomen, which could indicate the location of a tumor or other issue within the colon. If you're dealing with consistent abdominal pain or a general feeling of unease that just won't go away, it's crucial to have it evaluated by your healthcare provider. While not all persistent discomfort is a sign of cancer, it's a symptom that warrants prompt medical attention. Early detection is key, so don't hesitate to speak up about any ongoing abdominal issues you're experiencing. 2. Blood and stool. Another potential warning sign of colon cancer is the presence of blood in your stool. This can manifest in a few different ways, and it's important to pay attention to the specifics. Bright red blood is often an indicator of bleeding lower in the digestive tract, potentially from the rectum or colon. This could be a sign of hemorrhoids or other issues. On the other hand, dark red, maroon, or black-colored blood in the stool is more concerning, as it typically signifies bleeding higher up in the gastrointestinal system. This deeper, darker blood may come from tumors or other more advanced conditions. It's crucial not to dismiss any blood in the stool, regardless of the color, as it warrants a prompt medical evaluation. While the presence of blood doesn't automatically mean cancer, it's a symptom that should never be ignored. Bringing this to your doctor's attention allows them to investigate the root cause and determine the appropriate next steps for your health. Early detection is key when it comes to colon cancer, so be vigilant about any changes you observe. 1. Changes in bowel movements. One of the most common early warning signs of colon cancer is a noticeable change in your bowel movements. This can manifest in a few different ways. Some people may experience persistent diarrhea or loose, watery stools that don't seem to improve over time. Others may struggle with chronic constipation, where they have difficulty passing stool or feel like they're never able to fully empty their bowels. It's important to pay attention to any significant and prolonged alterations in your regular bowel pattern. If you find yourself running to the bathroom more often or straining to go, those could be red flags. Likewise, if you notice your stool has become thinner, ribbon-like, or has changed color, that warrants further investigation. While these symptoms don't necessarily mean you have cancer, they signal that something may be amiss in your digestive system and should be evaluated by your healthcare provider. Don't hesitate to bring up any bowel changes, as they could provide critical clues about your colon health. Cancerous conditions. Issues like infections, irritable bowel syndrome, hemorrhoids, diverticulitis, and other benign polyps can often mimic the signs of colon cancer. So, while these symptoms should definitely be taken seriously and warrant medical attention, they don't always point to cancer. A thorough medical evaluation, including a physical exam and relevant diagnostic tests, is essential to determine the actual cause and ensure you receive the right treatment. Remember, self-diagnosis can be misleading. Always consult with a healthcare professional for an accurate assessment. If you notice any of these warning signs, don't wait. Schedule an appointment with your doctor or gastroenterologist as soon as possible. Early detection is your best defense against colon cancer, and it could make all the difference. Take charge of your health, stay informed, and be proactive in both prevention and detection. Regular screenings, a balanced lifestyle, and staying on top of your health are your most powerful allies in this journey. If you found this video helpful, don't forget to hit the like button, subscribe to Healthy Care for more vital health information, and tap the notification bell so you never miss an update. Let's take the steps together toward a healthier, happier life.